Hey, how's it going? This is Franco with South Coast Medicare. I'm here with Dr. Lee and Kim, who is the program director here at the Gateway Medical Center. And we're going to talk about a little bit of things that have been going on, current issues. They have a new urgent care center, and we're kind of go over those things.
Right.
One question for both of you that we get a lot is throughout the coronavirus, it's been a pandemic, right? Were you guys ever shut down? And moving forward, will you guys be able to see patients?
No, we never shut down. Yeah, we never shut down. We opened throughout the pandemic.
Okay.
We give patients a choice, but most likely, if they have a cold symptom, we see them through telemedicine, and we bring the service to them, and at any time, any day.
Were you able to see your patients in person?
Yes.
Absolutely.
We do screening. We wore all still wearing our appropriate PPE, and we screen them if they have any cold symptom, any symptoms suggested viral symptoms. We put them through telemedicine, and if they're asymptomatic, no symptom, we see them via person.
In person, or over the phone.
Over the phone,
And
if the patient chooses to.
If the patient chooses to. But like you were saying, you also prefer in person because you're better able to diagnose patients, and there's just a better line of communication with your patients.
Correct. You know, in the practice medicine, is for us, the primary care is a feel and touch. Okay, we can feel and touch the patient. We make not like absolute diagnosis, but it's a more accurate diagnosis. But if the patient, for some reason, pandemic hit, the patient prefer to choose see us via telephone, we assess the situation, and if we think that the patient needs to be seen another time for more appropriate physical exam, we do reschedule for them.
That's such a relief to hear, doctor, because we have so many patients who are really disappointed that they weren't able to see their doctors in person for months, up to a year sometimes. They were stuck with just telephone appointments or virtual appointments, and many of our older patients don't even know how to use a laptop or an iPad, so that was, there was a bit of a learning curve for everyone throughout coronavirus pandemic, but it's great to hear that you guys are still seeing people in person, diagnosing in person, and I'm sure with all your expertise, you're finding other things that are basically giving better service to your patients.
Right, that's the goal.
Right. And when did this new urgent care center open up here?
So we opened up 2 weeks ago. We were down the street, around the corner, and we figured on-site was more benefits to our patients, so we are on-site in the same building as primary care.
Wow. And what's the address again here, Kim?
710 North Euclid in Anaheim.
Suite 107.
And 101.
101.
But basically the whole entire building is your clinic.
Right.
Okay, great. Yeah, because we have a lot of people who go to Kaiser and they're used to everything being in one building and it says Kaiser, but you're like a mini Kaiser.
Well, we are.
A mega Kaiser.
In a way, we better.
And which insurance plans are accepted here, Kim?
Which ones don't we take? We pretty much take Blue Shield, Cigna, HealthNet, you name it, we take it.
Wow.
Except for Kaiser.
Except for Kaiser. Because Kaiser's private. Okay.
Right.
Yep.
And is there anything else people inquiring about this clinic that they should know about their care here? What services can they get here?
Well, we are primary care. We see children all the way to whatever the age they are.
All ages.
All ages.
Okay.
And we provide physical exam, minor procedure, surgical minor procedure, and we also, like you say, we have an urgent care that enable us to see patients 7 days a week, and our urgent care open from Monday to Friday from 8 to 8, and Saturday, Sunday 9 to 5. So if our patient have any acute issue during the weekend, and or if they cannot make appointment with their primary care, they can always come by our urgent care and we give them the higher medical service, care for them, and we here to take care of them. So we provide the medical care that they need.
And you have the pharmacy on site. You
Yes.
have a
X-ray on
X-ray.
site.
X-ray on site. Okay, wow. So they can pretty much get everything here.
Yeah, one-stop shop all.
One-stop shop.
And we also have live interpreter machines that I didn't tell you about yet.
Oh my gosh.
So
Yeah, that thing is awesome. It's like a robot.
yeah, so it is a personal interpreter in the room with the patient. It's a little portable iPad. It comes into the room, and we get a live online interpreter that will interpret any language.
That's a new technology.
Right.
Okay.
It's very amazing.
Well, doctor, I know you're so busy. Thank you so much for your time and for taking the time to speak to people out there. I'll let you get back to your doctoring business.
Thank you.
Thank you, Dr. Kim. Dr. Lee, excuse me.
Thank
And
you.
Thanks, guys.